Australia for Believe in Action Australia. I'm here today. I have a special guest on. She's a detransitioner from Canada. Her name is Faith, and I'm going to bring her on and let her tell her story. I would like to get the story out there. I'd like the Australian public to hear her message because it's important to hear the dangers of transitioning, puberty blockers, and I want to bring awareness to our lawmakers in Australia and South Australia, especially with this bill that's going to be voted on very soon. So, hi, how are you?
Hi, I'm good, thank you. How are you, Angela?
Thank you. Good. I'm great. Thank you so much for organising. It's we're about 16-hour time difference, so I think it's PM where you are, and I've been excited to meet you face to face and have this chat. So before we go through with what's happening, what your story and what you've experienced, because I think what's happening in Canada is not much difference in Australia. And I've been doing a lot of research into the South Australian, especially the South Australian school systems, and it's not much difference state by state anyway. But currently what happens is teachers and leadership teams in schools have the ability to socially transition your child without the parental consent. That's already happening. And it's in the under duty of care policies in this, and also I've seen the training, gender affirmation training modules and things like that, which you can't get public access to. I was able to get some private access to that, unfortunately, and I'm starting to hear stories here and there in different states. We don't have a lot of detransitional type stories. I haven't heard many in Australia yet, but I'm thinking this is where we're going because more and more detransitioner type stories are coming out. But it's unfortunate when you see children hear about puberty blockers, and especially, there are some children starting at a very young age, but it feels like a cult. It feels like they're just being drawn in. And because they have these rainbow clubs in almost every school, and I feel like they're being targeted. Some children are being targeted, or whether it's some sort of something goes on. Like you go through a thought process, isn't it? Like you have a bit of dysphoria, or there's different reasons why people might transition, and I think for some there might be a bit of a trend thing happening too. Yes. Children are being taught how to be activists. That's part of the thing. They're really pushing the activism. They celebrate so many different inclusion days throughout the year, and they're taught like purple day and this day and non this day and non that day, and it's really brainwashing them. And I feel, and they take it as a whole school approach. It's not just taught in health lesson anymore. It's taught across every subject. That's what we found too. So I would like to hear your story. Does that sound familiar to you?
Yes. Oh, 100%. It has become such a widespread issue globally. It's not even just Australia, yes. Canada. It is every country is having this assault on their children, where parents are no longer allowed to have the right to decide what their kids are exposed to and what they're not. They're not allowed to opt out anymore of these things. Yes. There was something I heard of recently. There was a trans-identified music teacher in one of the schools, and the parents were not informed. And then once they did finally tell the parents, it was basically a matter of, you can take your own child out of school for that hour of class and then bring them back. So if you're a working parent, that's not an option for you. But then even if you do that and you want to try and protect your kids from it, you're then seen as a bigot. Nobody's going to respect you. And then there was another school situation where the parents were trying to just ask questions. They just wanted to understand what was going on. The school basically invited the parents in for a conversation and then pretty much expelled the students. And one of the parents was not present. So that other parent basically had to come and pick up the kids from school, because they were just kicked out. Like there was no discussion. There was no option. It's just the teachers are now saying, oh, your kids are here for this many hours in the day. So we know them better. We know them so much that we're going to be allowed to help this new emerging identity, and we don't even have to tell the parents who are there full time. That's just become the way that they're doing it.
When you sign
I
up,
was
I was going to say, I'll just quickly interrupt. There's a term that's used. It's a Latin term, and in the in Australian schools, when you sign a form, an agreement form, enrollment form, it's called en loco parentis, which means in place of the parent. And I think that's what it is. The states are in place of the parent, and they take that way on too much. Yeah. Sorry, continue. Yes.
No, that's okay. So I grew up basically in the precursor era to what you're seeing now. So the state was teaching, like the school that I was in, it was a public school rather than like a Christian or Catholic school, right? We have those options of private schooling, but I was in a public school, so it was government funded school. So you have a government that decides what the curriculum is, and the teachers have to follow it. So with that, because it goes through a school board, right? And so all of these schools in the same district, they all get the same curriculum. So it's not just one school affected if they change it, it's the entire school board and the entire district. Right. So then you're targeting every single child there in the community, not just picking and choosing. And so when I was growing up, I grew up in a religious family, but the public school, they weren't allowed to tell us anything about their religious views. Like teachers were not allowed to talk about whether they were Christian or not. That was the time that I grew up in. So they were still not supposed to discuss those personal things with the students. Some of them still would. Like I had a teacher, he was one of my, like, what are the homeroom teachers? And he was tatted up, he had a nose ring, you know, he looked a bit aggressive, but he ended up explaining that he was actually a Christian man. And he held those beliefs very strongly. However, he wasn't supposed to talk about them, but like he wasn't going to be bullied into silence at that time. Yes. And I found that very inspiring. Now, I fell away from the religion, from the faith for a while, especially during this whole transition thing. But that was a lot because when you're in school, you're learning about science, you're learning about math, you're learning about these concrete, objective things. And so when you contrast that with the religious aspect, I clung more to the things that had concrete evidence than I did to the book that my parents couldn't explain at the time. And that's hard to explain to a kid. Those are a lot of very big concepts for kids to understand. So when a parent tries to say like, oh, this is my faith, this is my belief, it doesn't make sense to kids all the time, or they take it too literally, right? They can go one way or the other. And I kind of did a bit of both. And then I ended up just kind of falling away completely from it. And I explored other religious views. I looked into different schooling things a lot. I was in the library a lot, so I was just reading different things. Some of it was fantasy stuff, and so it was just, my brain was everywhere. You know, I was exploring because I was a kid. You're supposed to, right?
Well, that's right. You have a big imagination. You're allowed to look at those. Exactly. That's perfectly normal.
Exactly. It's just when they get pathologized, and that's where it became a problem. Now, I had a weird situation with me because I was born with a birth defect. They had fixed it and repaired it when I was 4 days old. There was a hole in my diaphragm, so they had to put a mesh patch over it to keep the organs where they were supposed to be. And there was an issue with my lung, it had collapsed. So like there were a whole bunch of issues we needed to deal with when I was a baby. Now I was able to be stabilized, but like for the first week or so of my life, I was in a medically induced coma. I wasn't allowed to move because whenever I moved, I agitated the injury. So I was essentially institutionalized, which when you have an infant or a child who's institutionalized, it's basically just, you don't form that same bond with the parents that you would otherwise if they're able to hold you consistently. And, you know, you don't regulate your body temperature the same way because you're not against a human body all the time. And babies can't regulate their own temperature, so they do need that. And being in a hospital bed and in a coma, that didn't happen for me. So like I already had issues from the get-go. They were able to kind of stabilize me, and I was fine until I was about 2 years old. There was an assault incident that was violent enough. It broke my left collarbone, and it whatever was inserted, it reopened that hole, and it actually pushed about a third of my large intestine up into my chest wall. And so because the intestines were there, it plugged the hole. So I was still able to kind of breathe, but it presented itself as asthma because I wasn't gasping. I wasn't like ridiculously not able to breathe because my body was overcompensating for it. And so that was the issue, is because I was overcompensating, the doctors couldn't find it. And so from the age of 2 until 23 years old, they didn't know that that hole had reopened and that my third of my large intestine was up in my chest wall, collapsing in that left lung again.
Oh, wow.
So I grew up like that. I went through school like that. I was dealing with home life like that. And my parents weren't the most stable people at the time that I was growing up. So that was a little difficult. My dad ended up leaving the home, and my mom and him got divorced later on. So I was about 12 when he left. But
trauma within your body and within your mind, emotions and nervous system. Okay, so yes.
Yeah, so right from a young age, I was already experiencing a lot of issues. And then by the time I was 15, I was realizing I was blacking out and I was having behavior that wasn't like me. And so I ended up going to a doctor, and they were able to assess me, and I got a psychiatric evaluation. There were 2 separate appointments with a psychiatrist. In the first one, or I don't remember which one was which, but in one of them, I was diagnosed with depression and anxiety. And then separately, I was diagnosed with post-traumatic stress disorder, and then what they refer to as dissociative identity disorder. That used to be multiple personalities. But basically, your brain experiences something at a young age enough that you're not able to comprehend it and like integrate it into who you are. And so your brain just kind of puts up a wall and you can't remember it. And for me, that created a whole other like person basically that would hold those memories I couldn't. And there were a few of them. So that was a whole mess to try and deal with when I was a teenager. But then, so those diagnoses all happened when I was like 15 years old. Because of the post-traumatic stress disorder and the depression diagnosis, I was given an SSRI. So I was given Zoloft or sertraline.
Okay.
And there is a black box warning on SSRIs specifically for teenagers, especially if they're suicidal. But even in general, if you give that to a teenager, you're very likely going to have suicidal ideation and potentially homicidal ideation. I had both. And they didn't take me off the medication. I actually had the dosage upped. So I was on the SSRI from 15 until 24 years old. Just consistently, I would up the dosage with the doctor, and then eventually I started just upping it myself. I think I started at like 50 milligrams, and I ended up on 200 by the end of it before I quit. So I was on quite a high dose of the SSRI, and again, I was a teenager for a good portion of the time I was on it. And so a lot of the symptoms I was experiencing were also worsened by the medication they gave me. And that wasn't monitored or dealt with. By the time I was like 15, 16, I found out about I Am Jazz. And that's a show about Jazz Jennings. Jazz Jennings' parents socially transitioned them when they were like 2.
Yeah.
Because he wanted to play with his sister's toys and dress up with his sisters. And they thought, oh my goodness, he's going to be gay. So they took him to Marcy Bowers. Marcy Bowers, for quite a while, was the president of WPATH. And they are the ones who create the guidelines for transgender health, essentially. They're the world's professional. And then we also have like CPATH, so that's Canadian PATH. I think there's Australia PATH. Yes. Like every country kind of has one. But WPATH is the one who essentially writes the main guidelines that everyone's supposed to follow. They've actually recently had to state in court that their guidelines are mere opinions in the debate. They're not actually supposed to be medical guidance. So now any doctor who's been following it, they get to be tried individually.
Excellent.
Because
Fantastic.
they chose to take it on. Yeah, fingers crossed they'll go through with that. But, but that's a newer development. And so until now, people have been following it like it's gospel. And so they've been going around, especially because in Canada, they ended up passing a conversion therapy ban.
Yes,
and
same here.
They changed the wording. And so it then included, you're not allowed to have talk therapy with one of these kids who's potentially confused.
They can't even define what a man or woman is in Parliament.
Yes. Yep. No. And they're trying to give maternity benefits to trans women who can't birth babies.
Yes.
It's absurd what we've gotten ourselves into, but it's just because it's people putting up the idea of it's love, it's tolerance, it's kindness. It's like, yeah, but is it really kind to allow a heroin addict to continue taking heroin?
No.
Right? Like, is that
or
kind?
someone
Just
that
because
has
they think it feels better?
anorexia. You wouldn't
Yeah, no, exactly.
give someone, weight loss tablets who's anorexic because
Yeah,
they want to associate, it's
exactly.
maddening.
Well, because they're not allowing people. So a lot of the times when you listen to these doctors, especially I believe her name is Helen Weberly, um, she recently has been under fire because she will openly just go out in front of people and essentially say trans women are women, trans men are men. They can figure it out whenever they want, however old they are. Um, and she had been prescribing medications through, she had made some online doctor thing, but it's just they're already so delusional. They don't, like, they can't even define it. She will not be able to define what a biological woman is. But she was having a debate with a woman who I believe was already going through menopause symptoms, and she was saying, "Oh, that's very dangerous. You need to be on hormone replacement therapy if you're going through menopause because it's very dangerous to not have the estrogen in your body." And I'm like, "You mean like when you take the hormones out of the kids and put them through early menopause and don't give them estrogen?" Okay. Like they tell on themselves all the time. They are not following any sort of science. And even if they're given a policy, they still don't follow it. Like with the guidelines, the doctor I had seen, if she had actually been following them, because of the diagnoses I had already, she should not have been allowed to proceed because
Yeah,
there was no possible way to get fully informed consent from somebody who was consistently dissociative and blacking out. There's multiples of me up there at the time. I'm not paying attention, and she didn't even do a full proper diagnostic vetting process. So the doctors themselves don't know what they're talking about, or they know for a fact that they're hurting these kids and they're just going to continue doing it anyway because they feel like the tantrum the kid is going to throw if you say no is worse than how bad they're going to turn out when you cut all of their healthy body parts up and then they have to live with that. Like,
it's
normal common sense would say I'd rather deal with the tantrum, but they're just proceeding and fast tracking them.
parents are being told that would you rather have a dead son or a dead daughter?
Yeah.
That's how parents are being,
Yeah.
tricked into this rather than standing up for the child and pulling them away from these psychopaths, in my opinion, because I think there might be a very small percentage, and I'm not talking about the intersex people, because there's people that have masculine and feminine parts, and that's different. That really need those sorts of help or anything like that. It's a very small percentage of people that might have genuine dysphoria and have genuinely want to transition, but even though I still think that's still mental illness as well anyway. And
they do as well. They agree. Anyone who actually has the dysphoria will say it is a mental illness.
It is.
I should not be like this. This is a problem, and
or
it's
it's a fetish.
to live like that. Absolutely. Some of them,
Like
yeah.
some, when I was a teenager at school, I had no idea what gender dysphoria was. There was no such thing as gender identity. There were transvestites, so gay men who would dress up as women, but they never called themselves women. They were always either drag queen or transvestites. We knew that they were men, and they knew they were men, and they never wanted to use the women's bathrooms and compete in women's sports. But they knew the places that they could go to meet other people. But I think it's either entertainment or it's a fetish. That's how I saw it back then. I never met anyone who chemically or surgically transitioned back then. If there was a few cases, I wouldn't have recognized it, but it wasn't something that you spoke about and nothing that you thought about. But especially not in primary school. And now they're introducing it in preschool now, in kindy, which is ridiculous.
And that's extremely dangerous. It's psychological torture because these kids go from home, they're a girl, right? And then they go to school, and the school actually provides them with male clothing and a male name. And now at school, you're a completely different person. And then you have to shed that skin at school, put on who you were at home, and then go home. That is psychological torture. You are intentionally dissociating the child from itself. when you're doing that, and you're providing and facilitating the ability to do that. And if they can't fully integrate properly, if you do that young enough, they won't be able to fully integrate because they're going to be confused, because they're conflating masculinity and femininity. Yeah, exactly.
Did you feel like, can I ask a question? I will ask two questions. One, because I noticed that maybe a big percentage of the kids that might be transitioning might be on the autism spectrum. That's what I think. I feel like they're already being targeted. People on the autism spectrum seem to obsess more about stereotypes and placing people into boxes and categories. And I know there's a few medical research to indicate that maybe, I think it's about 80% of kids are somewhere on that autism spectrum. Maybe not in a transition from male to female to male, but using a different pronoun or having one of those imaginary genders that I don't even know. There's like a 70 of them. I have no idea how many.
Yeah. No. Now they've actually made autism a gender now. There's auti
gender. Is that right?
No, it's absolutely ridiculous.
I shouldn't laugh.
Just to answer that. No, I know. In regards to the autism, though, I have actually had the opportunity to speak with a couple of people who do have autism, like an actual diagnosis before it was over-diagnosed. And what I understand is that a lot of the time for them, there's an identity center, basically. Like they're very centered on finding out who they are. Because when you have all of these bits that don't always fit according to what somebody thinks they should, you're always not going to fit in quite right. And so if somebody just automatically says, oh, you'll come fit in right here, just all you have to do is just say you're non-binary. You don't even have to cut anything off. When you have that type of invitation, it's very, very tempting. It's tempting for somebody who's not autistic, right? Because you just want to be included and accepted. But then when you have that quirkiness and you haven't been able to find your own niche group yet, and you haven't been able to quite understand yourself and your own needs, somebody just kind of offering that to you makes you extremely vulnerable to that, to any type of cult-like community. Anybody offering you a solution, that's very hard to vet out.
Also, there's that sensory aspect.
Yes.
Where kids that like to pretend that they're cats and dogs are now being identified as furries. And in Australian schools, in primary school, I've heard of a few cases where they provide a litter box. Why? No, don't do that. That's insane. My kids used to have sensory issues. They used to love playing on their hands and knees. They have a very artistic mindset. They have a big imagination more than some other kids. And there's absolutely no way that I would affirm whatever animal they think they are. It's not just children. We had a police officer, South Australian police officer, who identified as a furry. And I thought, wow, these are adults now.
Now, to be fair, there is a difference between the furries and then what is known as a therian. So when you're identifying as the animal itself, that's a therian. When you're dressing up in these big furry suits, right, those are usually like furries.
Explain to me the difference. Is it because it seems to come under the LGBTQ plus banner with the furries?
Yeah. So the furries, there are two versions of a furry. You have the furry where it's non-sexualized and they just really enjoy wearing the thing. They find comfort in it, whatever.
Yes.
There are conventions for it. Fine. But then there is an aspect where it is inherently fetishistic.
Yes,
same thing with the pups, right? You can see those flags where they've got paw prints on them. That's, pups and bears and things like that. Those are different fetish subsets in the community, essentially. Those should not be a part of the LGBT thing, because the LGBT part was originally for just sexual orientation. If you just happened to not be straight, you needed to be put in a group so that we knew, oh, you're interested in us. Cool, great. We needed to know what genitals somebody preferred if they happened to be same-sex attracted. That's why initially transsexual people ended up having to be brought in, because if you start cutting your stuff off and putting on different ones, if I'm into one thing and you got the other, I kind of need to know that. that's why that all had to be part of it. Now they're just throwing everything in. They tried bringing in minor attracted persons because it's offensive to call them a pedophile. I'm sorry, I don't care about your feelings.
No.
Start caring about the safety of kids. I'll care about your feelings.
That's
but
right.
Other than that, not so much. Bringing in their pup play and the whole just any type of fetish, just kink in general. They started bringing in the BDSM community as a whole. And it's like, that's not what it was for. They're supposed to be two separate things. If you want to have a kink community, you can go do that. But that doesn't need to be a part of these equal rights and all of that. And again, we have them here. You want to go fight for equal rights somewhere, go fight out in the Philippines because they're not safe being gay over there. You can go tell them to go let gay people around. But we have that here. We don't need to be fighting for anything else. And it's all of these countries that already have the gay rights that now they're bringing in everything else that doesn't need to be there because it just doesn't have to do with it. And it's just they're trying to conflate the two and combine them so that everybody gets confused. Because now if you don't accept a gay person, well, you don't accept a lesbian, oh, you don't accept trans people. And it's like, no, I just don't want your kinks in here. That's the difference, but they're not letting that distinction happen. And so it's become a conglomerate of idiots at this point, to be honest. And that's
do what you want when you're an adult, but leave the kids alone. Just leave it out of the classrooms, leave it out of the schools. Let's concentrate on giving them a good education and stop messing with their heads. The other thing I want to ask is, you transitioned to male and you mentioned earlier about all the traumas, the childhood traumas and your dad leaving. Do you think you had a father wound that you needed to address?
Absolutely. I remember when I was younger, I made a vow to myself, I'll be a better father than he was. And I'm like, well, that's kind of silly. How can I do that? And then when I realized, oh, you can change your sex, that was kind of my epiphany of that's how I'll be a better father, right? I was convinced that I could change my sex, and because it was on TV, doctors were doing it, they were supporting it. I was like, oh, so it's been happening for years. All the science is settled, we're all good. And then I looked at the surgeries. And what was interesting to me is because I was like 16, 17 looking at the surgeries, I had to lie on the internet to say that I was 18 and above so that I could actually look at the post-operative photos of what I was getting myself into. So we can talk to these kids about top surgery, bottom surgery, but we can't show them pictures because they're genitals, right? Like they can't actually look at the photos that they're about to receive the surgery to get. They can't see any sort of preparation on their own, like independent research, because they're not allowed to, unless they lie on the internet like I did. But, the fact that you have to lie about your age to be able to look at the post-operative results of what you're potentially signing up for, that's quite telling that, maybe we shouldn't be offering these types of procedures to kids. But, it's a whole mess.
If you can go through the process, all right, so the appointments, what was the appointments like? How many appointments did you need before they decided, and you said, all right, I'm a boy, I'm male. How long did it take them to give you a prescription for puberty blockers? How long did that take?
So I had gone to the emergency room in 2016 because I was suicidal. I'm looking at my notes, so I have the timeline right.
Sure.
And so that's how I got referred to the gender clinic, because they thought my suicidality was because I was trans and my mom wasn't accepting it. That's what they had assumed. And so they rushed me into the gender clinic there. So my first appointments with that, she was supposed to be a gender therapist, but she didn't do her job. The first appointments were in March of 2017. And then by May, I was given a prescription for puberty blockers. So a couple of months worth.
So they automatically assumed, they made an assumption that you were suicidal because of that.
Mm-hmm.
Wow.
Mm-hmm. Yeah, no.
And that's what they were trying to convince
the entire
you?
Thing. Convince me, convince mom, because it was a matter of, well, if we don't give your kid the drugs, they're going to kill themselves. You don't want that, do you, mom? But the best part was they told her that because I was 16, 17 at the time, they didn't need her permission. They could transition me without her signature anyway. They were just asking for her signature as a courtesy and so that she could show solidarity with me. That was his whole spiel. That was the endocrinologist. And that was what he said to my mother. when he was getting her to sign paperwork for me to get the drugs administered. And it was essentially the same speech from the gender therapist herself, who's basically just a pediatrician. You know, she doesn't have any special training in gender therapy. Like, there is no way to be an expert in the field. It's not an entirety of a field, you know, and the doctors who have actually been doing these surgeries before it became a trend recently, they don't consider themselves experts because it's not settled science. It's all still experimental. Yeah, no, essentially the doctors who have actually been studying it. So there's a trans man, so a biological female who transitioned to male like about 30 years ago, right? So when he was doing this, it was very, very new. Doctors didn't know what they were doing. The doctors were very honest and said, we don't know what we're doing. You're going to be a guinea pig. If you're cool with that, we're good. But it was completely patient-led in the sense that the doctors had never gone through this type of medicine, didn't get any sort of training, but the patient was adamant that this was going to help them. That was why the doctors helped them. Nowadays, you have doctors sitting here telling the patients who come to them confused, because I just went in saying, I think I might be trans because it kind of matches with what I've seen online, but like, you're kind of going to have to vet me out here because you're supposed to be the doctor.
Yes.
So when the doctors don't vet you out and the doctors don't care to do that, then you just get funneled through like it doesn't matter, and nobody's getting told it's experimental. Everyone's being convinced that it's settled science and you're a bigot if you say no. If you're a parent who's concerned, we'll just call Child Protective Services on you and we'll just remove your children and give them to a family who will transition them. That's fine. Like, that's essentially what we're doing. And so when you have medical professionals facilitating child removal for an identity, like for a thought, you know, that's just, it's too far.
In Victoria, and I'm not sure about the other states, but I know in the state of Victoria, if you don't affirm your child's chosen gender, you know, as a parent, you could have your child taken away. It's already legislated there. I'm not sure of how many cases it's happening, but I do know that's what's happened in Victoria and where we sit in other states. So it's very serious. And it's not just teenagers. I think at a younger age now, we're talking about preteens. I want to get to the puberty blockers and everything like that. So what I understand is the medication for the puberty blockers is the same medication given to prostate cancer people or people with breast cancer. And also what I've heard, there's puberty blockers that are given to treat or just for chemical castration apparently too. So prisoners, it's the same medication. So you're either treating prostate cancer or breast cancer for men and women who are having those sorts of treatments, or chemical castration. So, and this is what they're giving to teenagers, and it's starting as young as 12, I think, is the youngest I've heard about.
I think Jazz might have been 11 when Jazz got there.
Wow.
So it depends on when the kid starts puberty. Because if the kid, so this is the interesting thing as well, because what else it will treat is precocious puberty. So if a child starts puberty too early, when they're like 8 kind of idea, they will give them that drug to stop the puberty until the appropriate age, and then they'll take the kid off and let them go through puberty at like 12, 13 when they're supposed to. The problem is, because people sit there and argue, well, we've been doing it for precocious puberty for so long, what's the difference between a trans kid? The difference is the one actually gets to go through its natal puberty that the body's designed for at the age appropriate for it, right? Because if you don't do it at a certain time, it can cause a bunch of growth issues and all of that and a bunch of pain. The issue with that as well, though, is there are people who were on the drug for precocious puberty and they said, you know what, it still caused a lot of side effects that I'm still dealing with. So even with that, that's still not even settled, and they're trying to argue that that's okay. But then if you look at a trans individual, these kids are not going through natal puberty. They're being given synthetic hormones that their body's not designed to take at any level, because it's a synthetic version of the hormone that their body's not designed for. And so that's the difference. You're not letting the kid ever go through its natural puberty. And even when you look at, so there were WPATH files that got leaked, and there were video conversations that were being had with Marcy Bowers and several other doctors who were under her. And so essentially they explained if a child is properly blocked, like if you follow the protocol that they're suggesting, which is you block the puberty at Tanner stage 2, which is before they ever started essentially, and then you give them the opposite hormone or the cross-sex hormone, they never experience, like for men to women, for a little boy to transition to a woman, if they're blocked at Tanner stage 2, given estrogen to develop as female, they never experience testosterone in the system, and so they never experience any sort of sexual arousal. That virility never develops, and a lot of these kids, if not all of them, end up anorgasmic and asexual because they just never go through that. And usually the doctors will catch them with the surgeries beforehand, but even with just the chemicals, if you give someone a puberty blocker or a chemical castration drug, right, it's already designed to stop the testosterone and the gonads from working. So you're already stopping fertility at that point. But then if you follow it up with the cross-sex hormone, that's like an automatic, you're permanently just sterilizing this person.
Wow.
God forbid you follow it up with the surgeries as well. But yeah, the surgeries are definite. You're not getting that back. With the chemicals, you could potentially, in some cases, bring it back, but that depends on how far they went. Because again, the doctors aren't following consistent protocols and procedures. And so there's not always a way. Like doctors are having a hard time with me right now because they don't really know what the doctors did. They kind of know what they gave me, but because of when it happened, they don't really know what stopped developing when, because I was halfway through puberty. I should never have been getting the puberty blocker in the first place.
Yeah.
So that's already how I know she wasn't following protocol, because I was 16, 17 when I got it, which there was no reason for that. I should have been allowed to just finish the puberty and start immediately on testosterone. That's what the protocol calls for. So she already wasn't following it, then I shouldn't have gotten any of them anyway. But it's just, the drug itself is a chemical castration drug. And we actually in Canada had deemed it inhumane to give to sex offenders long term. And so instead, we've now repurposed it for children, even though we can't give it to a sex offender. That never made sense to me, that the people who hurt children, we still have to worry about them, and we have to be nice to them and be concerned about their fertility. Because with an adult, if you give it to an adult, it doesn't affect their fertility at all because they're fully developed.
Yeah. Yes.
So the moment you stop it, it comes back. There is no permanent castration there with an adult. But with a child, there is the potential for permanent infertility. And they just don't seem to worry about that.
When we were texting the other day, you mentioned that if you ever homeschool, if you ever have children, you like to homeschool, and it was more of if, and so it seems like you have fears that you might not ever be able to have children. I pray that you heal your body. I truly do, because having children is a wonderful experience, but you do hold that fear, don't you, that you might not be able to.
The question is always there because I never got, so I had the opportunity to speak with a trans-identified man, so like a female to male. They had the option given to them to freeze their eggs before they had anything done. Because when I was speaking to the doctor initially, I had expressed that I didn't want kids. She didn't give me that option. I was never offered any
16 years old. 16-year-olds
Yeah.
don't think about wanting to have children. They don't plan.
The stupid thing was, it wasn't even that I didn't want them. It was because of my history. I was afraid I didn't know how to look after them.
Yeah.
And so I did want them. I just thought I would screw them up. So I figured it was better to just say I didn't want them. And it wasn't until I got older. And there was a point I was with a biological female who, like, I was dating them at the time, and they had concerns they wouldn't be able to carry. And so because I was trans-identified, I really had to think about, okay, if I'm with this person and we do want kids, I would have to carry it. Am I even able to do that? Yeah. Am I willing to do that? And so when I ended up getting transferred into the adult endocrinology side of things, he slowed things right down immediately because I expressed a slight hesitancy essentially with that. because I was like, well, maybe I do because I'm with this person. And if they can't carry, then I would have to. So that got me kind of thinking about it again, even just in the logistical, biological sense of I could technically carry them. The other problem for me is I did have a history of polycystic ovarian syndrome. They changed it now to like polycystic metabolic syndrome or something. But essentially, I get cysts on my ovaries when they're trying to develop the eggs. And so that already made the fertility issue. Yeah. Yeah. So with having that, because that was always missed. Like I had painful periods and I was trying to get doctors to look at it, but then they ended up fast tracking the transition. So they completely missed it. And so that was just kind of always a concern anyway, but then especially after I found out what the drugs do. And because a lot of people have these issues even after a short time, and I was on them for years. So, you know, you never know. But the fact that so I do have a cycle that returned, which was a positive sign. So that's hopeful, but it's just the fact that because I never got any sort of like fertility testing back then or now, it's up in the air. And so until I try, we won't really know for sure. But yeah, no, it's certainly not something you should have to think about as a teenager. But yeah, that's the state we're in. It's ridiculous.
So you started on testosterone, and it's testosterone that you went on. How did you feel mentally and emotionally having the male hormones in your system? Did you go through a period of time where you thought, you know what, this feels really good, or did that slowly? When did you get to that point where you realized you were never going to be a male, or it was not the right thing? Talk me through that.
Yeah. So my detransition was a bit slower because it wasn't like I didn't come to the realization until after I'd stopped the medication. So when COVID was happening around 2020, they had to change the vials because they were running out of those that I was getting my testosterone in. And so they gave me a different version of testosterone that was more expensive. It was pre-sectioned packages that you would get of a gel. And because of how expensive that was, I would buy 1 month's supply instead of 3 months, and then I would ration it. And the fact that I was rationing it while at the same time not taking my antidepressant properly, the SSRI. So SSRIs have really, really bad withdrawal. And especially if you're on a higher dose of them, they have a really bad one. And I would forget to take it basically until I started feeling withdrawal. And I was like, yes, I forgot my pill. So the fact I was missing it so frequently, I was like, that's probably not good. And I was doing the same thing with the testosterone of like, I was supposed to use it every day and I was using it like every few days, or I would just forget. And like I had become disenchanted by it. I didn't really care about being a man as much at that point as just I wanted to hide away and not be noticed as much. And I wanted to just be able to kind of move on with my life. And I had accomplished that. I was very androgynous looking. I could pass quite well. I could enter like male company and they didn't really mind my presence. I didn't come in acting like a typical female though. Like I didn't come in thinking I knew everything and trying to talk over them. I would actually listen to them. And I was very fortunate actually to be able to have men open up with me about their own struggles and to see that being a man was not all it was cut out to be. So by the time I was 22, my dad passed away in 2021. And my mom had been in the hospital for surgery, like right around the same time he died. That was not fun. And then in 2022, my mom's dad passed away. So by 2022, I had also, so because of COVID, there was like a COVID testing unit that was created. So I was able to work with them through 2020 until 2022, basically. And when everybody basically said, mandates aren't necessary anymore, it basically doesn't exist, we're fine, the whole unit got closed down. So we just all got paid out. So I didn't have to worry about it. And so I lost the job at the time. My grandpa had passed away. My dad passed away the year before. So I was just not having a great time. So I eventually just decided, you know what? I haven't been off medications basically since I was 15. So we'll just see what happens if I go off all of them. So I quit the testosterone and the SSRI cold turkey on my own. That took about, I think, a week and a half of withdrawal before I was like settling a little bit. And then once I was able to settle, I was able to kind of reassess my mental state. But it wasn't until 2024 there were those WPATH files that came out. And once those came out and I saw for myself that the doctors didn't know what they were doing and that according to their own guidelines, they didn't follow them when they were transitioning me, that kind of made me realize, oh, so I'm probably not trans. I'm just dealing with all these other issues and they just didn't know what to do with me. And so at that point, like I think it was March, the WPATH files came out. By April, I had started resuming using my birth name and went back to being female. And then by the end of...
So you weren't really thinking that you were male. That wasn't it.
Mm-hmm.
You were just taking them because you thought you were told to. You were just told the wrong information.
That was the other thing as well. So when I think about something, I kind of do my own research. And so back when I was like 15, 16, I hyperfixated on it and I had looked into so much of the history. I thought that I was the old version of transsexual back from the 80s. Wow. That was the definition I was using, that I thought I was, where I just was a woman who happened to think I would be better as a man. And like my own physicality made me think that, like I just had a bit of a belly. And so I was like, oh, I'd look better as a man. Because that type of physique is more tolerable to people on a man than it is on a woman. There are different standards there for attractiveness, right? I figured that my body just fit male standards better than it fit female. And I was like, I'll just be a guy. And I was a tomboy. I liked playing with boy toys. I liked, all of those stereotypical things.
I get that.
So I did fit the old version of it quite well. But it was just that bottom dysphoria that I didn't really have, I was uncomfortable with the fact I was a girl, but that was because like I was already sexualized before I ever had the secondary or tertiary characteristics. So like to have any sort of attractiveness come up, I was like, I don't want any attention. I want it all to go away. And because of the dissociation, I would actually forget, because I had alters who were different ages for a long time. And so if one of them would come out, they wouldn't know how old I was and they wouldn't know what kind of physical development I was at. And so if I had to squeeze through a space, I would like run my chest into door frames and stuff because I would forget they were there. And so that was always, it was just painful because they were still developing and it sucked.
Yeah.
So like a chance to cut them off or just bind them out of the way, I was like, absolutely, sign me up. But binding them even is not a neutral act because you're physically pulling the tissue apart to flatten it. And so that actually will pull your glandular tissue off, like off your sternum and off your chest wall. So you can't just tell kids, oh, it's fine, you can do that. It puts pressure on the ribs. I had a collapsed lung. I shouldn't have been using something like that. Nobody knew that because nobody decided to do their job. But it was just this whole mess of like, any adult I went to didn't really understand what I was saying. Because when I said I thought I was trans, they assumed the new version of transgender, which is just anyone can think they're a unicorn and you can have whatever you want. I didn't need that. I needed somebody to look at me and say, no, sweetie, you're not. What you're thinking can happen, not what can happen. Like, and even going into it, I never wanted bottom surgery. I was like, top surgery is the farthest I'll ever go. I don't want bottom surgery because I looked at the photos and I was like, I would be more dysphoric with that between my legs than what I have now. I'm good. Thank you. Yes. And so because I went into it with that mentality, I was not nearly as blind, I guess, as some of the other kids. Like I had dissociative problems, but I could see what they were doing to my mom. I knew that was manipulative. And I knew that because they had a social worker talk to my mom at one point, and my mom specifically asked this woman, could the sexual assault history have anything to do with the transition? This woman looks my mother in the face and says, so a lot of the trans people do seem to have a history of abuse or trauma, but we don't think that that's the primary reason they're doing it. I'm like, so you did have your own research.
You did have a really bad sexual experience at a young age. Yeah. I've heard of that as well. Yeah.
And even if it's not like inherently sexual, any sort of trauma will make somebody try to look for somewhere that feels comfortable and safe.
Well, you
And
don't
this
want to
is
be
what this whole
yourself.
community is good at.
You want to
No,
forget.
exactly. Yeah.
You want to forget the trauma. You want
Yeah.
to be a different person for a day. And
Mhm.
I understand that. I
Yeah.
understand.
And sometimes that is even the trauma. Like if you're blamed for something that you can't control, and then a doctor comes along and says, "Oh, we can change that." You know, like a lot of the time, boys are abused by mums just in
Yeah.
the way of like, if you're more feminine, I'll love you more. Because they don't, if they look at men or young boys, a lot of the time, I find somehow the women see natural masculine behavior just as toxic masculinity.
No,
And so they just talk their kids out of it when they're so young. And so the boy grows up effeminate and then they're afraid he's going to be gay. It's like, well, mom, that was your own fault. Like you did it, you know? But it's if
they
you punish
teach
that
about
type of behavior, you know?
there's lots of feminists out there teaching about
Yes.
toxic masculinity, but they're not looking
Yes.
at how toxic the feminists are.
No.
I want to know what your thoughts are, and we will, if there's any messages you would like to talk to, any advice you would give teenagers or parents, and any messages to our lawmakers, on your thoughts on the puberty blockers and banning, because I would like to see them banned. I don't think children should be taking puberty blockers. I think they should experience their body and develop fully into their body. And when they're adults, I'm not a big fan on transitioning, but I think the mental health needs to be addressed.
Yes,
So
100%.
I'd like to
Yeah.
hear your thoughts on all that.
One thing I will say when we talk about the trans agenda, you almost can't even mention it without tying in the pedophilic agenda, because
Yes.
if there was a woman at one point I had met, and she actually walked around with a sign that had the list of the pedophile agenda on like a big like screen that she would have and roll out, and essentially teaching people that they can change their sex at all, but then putting that thought into kids' heads. That's part of it, because it's just corrupting the child in itself and corrupting the truth around it and the natural order of things, which is part of it, because you're destabilizing the kid, and that's what they want to do, especially if you teach it that it can transition and the parents are adamantly saying, well, no, that's not what happens. That immediately causes a rift between the parent and the child, and now the child is isolated and vulnerable. And specifically what the trans community does is they have these safe adults that will take the kid and transition them, and they'll set up a plan where the kid can escape from the home and they'll just take them and the parents won't be any the wiser. So
do you think that's
there
where the
is this predatory element.
Do you think that's where, sorry to interrupt, but do you think that's where the consent education comes in? So they can teach children at a very young age how to consent.
Believe that these kids, they think they're trying to teach kids that they can consent when they can't. Because if you look at any law, kids cannot consent to sexual activity. That's statutory rape. We all have an age where it's a law where if they're younger than this, you can't do anything with them. They can't consent. In Canada, we don't technically have a medical age of consent. So if it comes to a medical treatment, like if it's a kid with diabetes, the doctor can explain it to them, but the kid doesn't understand what's going on. They rely on the parent who's going to take the information home, figure it all out, do the procedure, and then you'll teach the kid eventually as the parent. The doctor doesn't have to do that. With transitioning, though, they're now teaching the kids, you don't need your parents' consent. We're the only guidance you need, and you can make the decision yourself because you're old enough, and we believe that you're cognitively capable of doing that. Any
mature
adult,
minor,
especially a doctor. Oh, I hate that. But that's what it is. That's precisely what it is. And the only people who use that language are pedophiles. So it's like, no, I'm sorry. The moment that you're trying to empower a child that they can make these decisions, like again, emancipation from like an actually abusive family, that is a completely different story than a child who is systematically confused by the teachers or by the doctors or because they saw something online and now are being corralled away from the parents with basically every adult around them creating this shield that the parents can no longer touch them. Like when the parents lose their rights to their own children,
Yes.
but that's essentially what's happening is the school, the government, the doctors, and now the communities at large are just trying to completely raise the child without the parents. Because to be fair, for a long time, that is almost what happened because parents were then empowered. Oh, both of you need to work out of the home because everything got so expensive. And it's just, oh, well, women can work too. So why don't you? And so now we have two incomes that can both be taxed and nobody has to look after the children. So then who do we get to look after the kids? Well, we get daycare, we get babysitters, we get this and that, we get schools.
The state.
You create jobs. That's fantastic. But then you have people who treat your kids like they're your own. And you want that to a degree. Like if I send my kid to a daycare or a school, absolutely, I want you to treat it like it's your own, but not if you're insane. If you would transition your own child or castrate them or let them get a tattoo at 12, you're an idiot. Don't treat my kid like it's yours. But there's not that open distinction of what these teachers believe is okay anymore. And so then the teachers have free reign while the kid is in their care. And like here, so the doctor that transitioned me, she works at a children's hospital. It's like right in the middle of the street. Down the street is a middle school. Further down that same street is a high school. All of the kids, at least from the high school, were being funneled up the street to the hospital through the teachers with no parental consent. I'm pretty sure they were probably doing the same thing with the middle schoolers, but I'm not sure. But I went to that middle school. I was born in that hospital. Had I been born anywhere else, I would have died. So it used to be a good hospital like over 20 years ago. But then by the age of 2, they were missing things. And that's how that birth defect got missed again when there was a complication. And then throughout my entire life afterwards, I would go to the same hospital through their emergency room. They have a family practice that's connected to that hospital. I would go there. So they had all of my records, they knew everything, and they still just didn't get it right. And so all of these kids are like right down the street funneling them. And because of the way that the schools are running themselves, the parents don't need to be notified. They don't need to be notified about the new emerging gender identity at all. And they don't need to be informed if the kid's going to the doctor or not, because the teacher can basically set themselves up as the guardian for them instead. Some schools even have the nurses right on staff. So that's even better. They can just do it all in-house. But yeah, no, it's a complete mess, and it is just an attack on the parental rights at that point because they think they can raise your kids better than you, and they're going to tell you how to do it, essentially. And if you try to tell them otherwise, well, then you're the problem, right? But yeah, no.
Or they have to consider if the child is suicidal, and under duty of care, they can overtake in Australia, pretty much. And it sounds the same, just different wording slightly, but they can make referrals. I think in Australia, I've heard of a few cases where children have entered a gender clinic, children, teenagers, not adults, after one visit, are given puberty blockers. So it seems like things are happening very quickly now with, they should have more psychology visits and more longer period, but I think they just prescribe
psychology visits. Yeah. So that was the thing with me. It was a bit slower with me than it is now, but I still never saw a psychologist.
How long ago
there was a social worker. So I started the process in like 2016 when I actually got medications and saw the doctor, 2016, 2017.
So you were one of the first ones.
So she had opened that gender clinic, and I think it was people who were in there in like 2016. I just missed the cutoff by like a year, where she was doing a test for her first bout, essentially, of this gender clinic and their patients. Because I saw the head of the gender clinic. She's actually now been appointed the president of the Canadian Pediatric Society. So now she's actually in charge of everybody's children and how all of the doctors have to look after their children. So yeah, I've been trying to bring that to awareness, and everyone's just slow. But there was a journalist? I think he was a journalist. I believe that's the title he uses. But there was a journalist anyway who was able to write an article about her and in regards to how she had treated me and I believe two other patients of hers. The one, she actually did call CAS on the mom because she was concerned about the child getting a double mastectomy. So she absolutely will use the Child Protective Services against the parents. She's already demonstrated that. But even that, she'll get in the patient's face, she'll get in the parent's face if you turn on her. She's not pleasant.
Okay. Thank you so much, Faith. Please give us a final message. Teenagers, parents going through this, and to our lawmakers.
For teenagers or just anybody who thinks they are trans, really, really think about it for one thing. There's no wrong way to be. Whatever sex you were born as, and having those different feelings does not automatically mean you have to just surgically or chemically alter your body. The world is significantly more free than that. You can wear a dress if you want and still be a man. That's fine. There's nothing wrong with that. You can wear different shorts. You can play sports and be athletic or capable. Being capable does not just make you a man. You can be a capable woman. That's fine. There's nothing wrong with that. There's no reason you have to change that. You weren't born wrong. Even if you think that you have the dysphoria or whatever you want to think it is, that's fine. You're not born wrong. You're born how you are. You figure it out. If you want to change it later, that's fine. But wait till you're fully developed, because they lie to you about the complications. And if you do it too early, you don't get the results that they're promising. You don't get the results anyway. But especially if you do it too young, just at least wait until you're older. Like 25, honestly, I would say at least wait until you're 25 or older, because your brain's not even fully developed until you're at least 25. And that's if you don't take all the drugs. In terms of parents need to protect their rights and protect their kids. Pull them out of school. That there are other options. Either find a different school or teach them yourself. But if they're starting to put poison in your kids' minds, you take them out. You don't let them continue to do that, because it's hard to get that out of your kids' minds afterwards. It's very, very hard to convince them that it was all a lie. To the teachers and adults who are still attempting to teach kids anything about it and think that kids need to know, they don't. They don't need to know about it, and they can't possibly understand it because they're children. They're kids. Leave them alone. Let them go play in the dirt. They can go hang out with their friends. They can go ride a bike. They can go play on a swing. They don't need to have anything cut off. Wild concept. Lawmakers need to educate themselves more in the general populace. I find that people in the legal system, like judges, lawyers, anything to do with that, they're told what news stations to watch. They're told where to get their information. And at the moment, the researchers and the doctors, the clinicians, all of the experts, they're all lying to you. They're not giving you all the information because they're not listening to people like myself who say this didn't work and you're a bunch of liars. I would have ended up with complications. I was given approval for top surgery before I even got the testosterone, which is just completely incorrect, even according to their own guidelines. The doctors are not even following their own rules. You cannot trust these people to give you accurate information. They're not. They're not telling the truth to their patients. Their patients are children. So get your information from people who maybe actually took the drugs. We can tell you how that feels. It's not too pleasant. Going through menopause when you're like 17, that sucks. That's not great. A doctor could have told me no. That would have been fantastic. But it was illegal for the doctors to tell me no. So, different laws would be lovely. A statute of limitations, actually, just in terms of lawmakers, the statute of limitations seems to be a very, very big problem for a lot of detransitioners, because here it's 2 years. I don't know where it is, like everywhere else, what it is, but in Canada, it's only 2 years. I believe the States was also 2 years. So basically, from the last treatment to when you find out that it was wrong for you, you have a 2-year window. If it takes you longer than that, you don't get to pursue anything legally because we can't file anything under medical malpractice, which is what it is. And so because of that, we can't even bring the cases to the lawmakers to be able to make them aware of this being an issue. So I don't know if lawmakers could address the statute and actually allow people to pursue it legally, that would be fantastic, because that seems to be, I think, the biggest roadblock. And if we had a statute that was like about 10 to 20 years, because when you're in a cult like that, it takes about 10 to 20 years to get through the entire process, get to the end of it on all the procedures and say, this didn't fix anything, and then have to turn around and heal yourself after. These people can take a very long time to heal to the point that they're able to pursue any legal action, because it's a lot of trauma that you're going through, and you're probably healing from the trauma they ignored in the first place. So the statute of limitations would be fantastic if lawmakers could address that, but that's very high up.
Yeah,
but, yeah, definitely re-educate yourself for sure, and make sure that you're getting information from people who actually took the medications, not just people who prescribe them.
That's right.
You know,
we hear stories. I won't keep you too much longer, but people who have had the surgeries, especially the bottom surgeries, there's a number of issues. They have to, the men who transition into women have to keep getting dilated over and over. So it's an ongoing thing. I'm not sure about what the women who transition into men, what they experience, but the other thing too is, I suppose there's functioning. So maybe, they might have dysfunction in their sexual life as well. I've heard about that. Also, there's a higher risk. Like you said, it's like going through menopause. So you're more likely to get that bone density issues, that old women would get, osteoporosis.
Osteoporosis, yep.
So you're more likely to experience those at a very more younger age. And no matter what, you'd be constantly on medication and medical treatments for the rest of your life once you've had those surgeries.
And they don't tell you that either. Yep. They don't tell you that you have to keep the hole open every day. They don't tell you that you have to keep yourself accordingly. With the female to male, those complications aren't talked about a lot because a lot of them are gruesome. Essentially, the worst I hear about is the thing just falls off. So you go through all the work, you get this tube made out of a bit of your skin. Usually you have to get another skin graft to cover whatever skin you take. And then sometimes your body just won't take and it just falls off. That's about the worst. But then you also have urethral issues, because with female to male, if you're actually creating a phallus, you have to lengthen the urethra. We're not really well versed in doing that medically, because we usually don't have to make a female urethra longer. So they're kind of not great. You get, there are two main problems. One is a constrictor, so it closes up and you can't actually use it. You can't pee through it. The other issue is you get fistulas. And so fistulas are just holes that aren't supposed to be there. So instead of just peeing straight down one tube, you get a surprise hole and you just start peeing out the side like a sprinkler, right?
Oh, wow.
Urinary issues, just in the sense of like bladder control. A lot of people have issues with that. Urinary incontinence. The other problem as well, a big reason why they have to rush the female side of things is because when you're taking testosterone as a woman and you go through menopause, your vagina and your uterus can pretty much just die off, and that's called vaginal atrophy. And so because there's a dying organ inside of you, it can create and cause sepsis. So in order to avoid that, they try to rush you through to getting the hysterectomy, to getting the tube put on, so that you don't fall under sepsis because of the organ rotting inside you. So they at least have to get the organ out. They at least have to get you to have a hysterectomy if you're on the testosterone. That's why they push it so fast. And then the bottom surgery is just the other part of that. Some of them get it, some of them don't. But yeah, that tends to be why they're rushing it, because otherwise these people are sitting there with all of this pain and discomfort, and then they end up in the hospital septic. And so, because your main female reproductive organ is dying inside of you because it's not getting the estrogen it needs, because it's an estrogen based, like all of the cells in that organ require estrogen, and it's being starved of that and constantly dying. So, and again, you're not told this. Like, I probably have vaginal atrophy. I've been suffering with it since I was on the testosterone, came off of it.
Yeah.
But every practitioner I've tried to talk to, actually, my practitioner recently dropped me. And when I was trying to arrange for another one, so I've been trying to get a new doctor for like 3 months or so, but the previous doctor ended up dropping me before I could get a new one. So they finally were able to try and get me an appointment. They called me today for October. And I'm like, my symptoms have already been worsening, and it's taken you 3 months, and he's been on 2 vacations already in the time that I've been trying to get a new doctor. So it's like,
is
okay,
it harder?
go on to.
Sorry? Is it harder to get a doctor's appointment now that you're detransitioning than if you wanted to transition? Are you getting more help, less help now?
Yeah. Oh, yeah, 100%. Yeah, transitioning, it was like I was put on the puberty blockers. The lady was convinced within like 1 or 2 appointments I had gender dysphoria. I got approval for top surgery on my 18th birthday, and then like, what would that be? 14 days later, I got my first testosterone shot. So, it all went really, really quick with that. And then the moment I aged out of the youth clinic, everything slowed right down. And now that I'm trying to seek any sort of medical care to try and heal from whatever happened, nobody knows what to do. And so it's just like, even if I can find a doctor who wants to help, they don't know what to do because they don't know what happened.
Because it was experimental.
Yes, precisely. And you can't just walk up to a doctor and say, hi, I was experimented on. I'm sure that's not your expertise, but, can you help me? Because they just won't take you at that point because nobody wants to try and experiment on an experiment. Good doctors don't want to lose their license. But that's the situation that people find themselves in if you go down this path and later on find out, oh, maybe I was wrong. You've got a whole host of issues that you have to deal with all on your own because the doctors aren't going to help you. Like the ones who do it to you, they'll drop you. They just ghost people. Surgeons, they ghost their patients. They won't follow up if you get complications, or God forbid they do follow up with you and make it even worse. I know a lot of people after they have the double mastectomy, because there was such a surge in people transitioning, the doctors basically made a grab for that practice. And so it's general surgeons who are applying and saying, oh, I'm a trans surgeon. They might have never done these surgeries before in their lives. And you're going to be the first guinea pig. And they don't tell you that. And so a lot of these girls go under the knife and they get too much tissue removed. And so even if they regret it later and they want to get reconstruction, there's not enough tissue to work with because it was all taken out. And it was taken out improperly. So there's nothing left to work with. And so these are the options you kind of have to weigh out, but they don't give you those options beforehand. So, I'll let you know. They're all lying to you. They cannot provide a penis that works like a man's penis. It doesn't do that. They can't provide you with a vagina that works the way a natural one. I slept with a post-operative trans woman, right? I saw them close up. No, as someone who has it, it is not the same thing. It doesn't work the same way. And lo and behold, she couldn't use it for penetrative sex.
Wow.
She had a boyfriend, couldn't use it.
Wow.
So they had to involve other people in the relationship. And it's really sad because a lot of the time, especially if it is for a sexual gratification reason, you get all of these surgeries and then you can't even use the thing that you wanted for the whole purpose of it. So what did you do it for? And the doctors who do it to you won't help you fix it. So it's really, really unfortunate.
It's almost like a form of sexual abuse. When you're in a good, healthy relationship as an adult, you want to have that enjoyment, and that would be abusive not being able to enjoy that part with your partner. You want to enjoy that, so that to not be able to have the sexual satisfaction as an adult. It's not an easy topic, but it needs to be addressed. So,
well, and even if they have, so some people, if you cut off the gonads, they don't have any sex drive at all. Some people still retain the sex drive, but then if you cut off everything, there's no way to release it. None. And so you're just stuck in perpetual aggravation with
Bring up
absolutely no relief.
hysteria. It would make you actually mentally unwell if you can't have that
And
outlet.
the problem, they already are. So back in the 80s, when people were saying, I think I'm supposed to be the other sex and I want to cut my sex organs off, they were looked at as a mental illness, and they were treated as such. And so their mental health was addressed before anything got cut off. They needed to make sure you weren't like absolutely nutty. You just were really adamant about this one thing. Okay, fine. But now they're completely ignoring any other mental health issues, and they're treating this identity crisis as if it's a completely physical issue that'll be solved with surgeries and chemicals, when it's not. And so then when you pump a sick brain already full of chemicals that are not designed for the body, you get worse mental health issues. And then again, you're not even addressing them in the first place. So these people are extremely mentally unwell, and they're not getting help. And then they're allowed to come out in the general public, and everyone's afraid, and we wonder why. But and then there's also the option, they complain about violence against trans people.
Yeah.
But within the community, they push, like trans women specifically, but also trans men, they push this idea that so for a trans woman, the peak you can get is to be attractive to a straight man, and for him to basically not know that you were ever born a male, and for him to still be willing to sleep with you. So these people will go online and they'll meet up with people and not disclose to them that they were ever a man. Now, women may find it a little difficult to understand, but for a man, like a straight biological man who has been raised that being gay might be a bad thing, especially
it's more of a
if he's
game
just
to
not.
them.
Yes, 100%. And they're playing with their lives. And then it comes out that, oh, this so-and-so died. And for one, they won't even tell you that it was like a close partner or somebody that they were intimate with, right? They'll just try to say, oh, it was a hate crime. And it's like, no, the person lied, didn't tell them, oh, by the way, I was a man. And so if they ever find out, they're very uncomfortable with that, because that's a consent issue. They're not consenting to sleeping with someone who used to be a man. They're consenting to whatever you are now, and that's fine. But that disclosure needs to be there. You can't just pop that on as a surprise to somebody. And if you do, you do deserve what comes to you, because that's not fair, right? You would want somebody to tell, because this is the whole fun thing I love. The trans women will come and say, oh, well, we're lesbians too, because we like women. But a lesbian, like a biological woman who is attracted to biological women, it's transphobic for you to say I'm a lesbian and use the term proper. So they get offended when they don't get to sleep with who they want to sleep with. They're allowed to have preferences. But if you're a biological person who identifies with your biological gender, you don't get to have a sexual orientation. No. You don't get to have a preference. You have to like me anyway. No. No, we don't.
I get. We hear those sorts of stories here as well.
Yeah. No, it's ridiculous.
It is, and it is. It blows your mind because of how offensive they appear, but it feels like it's the same narrative. They've been fed the same thing. They have these meetings. They've been told the same script, and it does feel, in some cases, it feels like you said it. Whether they've just been brainwashed to think a certain way, and they've been pushed down this activism road, and they're using the same sort of argument narrative. It's like they've already premeditated in their mind what they're about to say. But it's but on the other hand, it feels like it's more of a game to them, because it's sad. It's sad. One last question before we go. Do you think people's mental health, because apparently they're suicidal beforehand because they're not transitioning, are they more likely to be suicidal or have those thoughts of having thoughts or mental health issues afterwards? Does it get worse, do you think, or is it?
So there's actually research on that. A lot of the time when they argue that people will kill themselves beforehand, that's suicidal ideation that they're talking about, not completed suicides. When you look at after the fact, So when someone has actually gone through all of the hormones, they've had the surgeries, they've been affirmed, they end up killing themselves after the fact. Completed suicides are higher after transition because
so
a lot of
sad.
the time, if they're not vetted properly, and this has been apparent right from the very beginning of these people coming in. There was a psychologist that spoke at a conference I was able to attend, and he had been treating patients like this essentially from the 90s when they started to kind of become more apparent. And the one patient he spoke about in the conference specifically, he had followed throughout from before the transition, during, and after. And that individual got everything they wanted. Everything went as well as it could have. And then by the end of it, after they had everything, there was nothing left to chase. And they were still left with everything they were running from in the first place. Even though you cut everything off, you still have the memories. Your body still remembers, even if it's cut off. And so they still have not been taught how to cope with that. So they ended up ending their life, unfortunately. And
they don't get the right supports.
Yeah, no, exactly. And if you don't get the right supports mentally, everything else falls. And that's the problem. They're focusing so much on the outward appearance. They don't tell these people it's cosmetic procedures that they're getting, right? They're always told, oh, I'm going to change my sex. I'm going to be a boy. I'm going to look like a man. No, you're not. You're going to look like a woman who got her breasts cut off, and then you'll have more scars if you have other things done. That's not the same thing. And whatever organ you think they're giving you is not a natural sex organ that will function the same way. And so all of it is a lie. You have to be mentally stable enough to understand that you're biologically what you were born as. You are wanting to do these cosmetic procedures on the outside to make the outside match how you feel on the inside. That's fine, but it doesn't mean you're automatically changing your sex. That's not what happens. You can't change sex. And so anytime someone's trying to sell you the easy solution is probably not going to be as easy as they're selling you. And that seems to be the biggest issue, is just everyone gets lied to. And they believe the lie because it's easier. It's easier to get something cut off. Because when you think of surgery, people think of like, oh, I go to sleep, they do all the work, and then I wake up and recover. That's great. I get like a 6-week vacation. Sweet. Awesome. That's not what happens.
No.
And then some of these people wake up and they're in brutal pain. Right immediately after surgery, sometimes they'll regret it. But because they're surrounded by all of these people who are smiling and look at you, aren't you so excited? So they feel like they have to play the part. It's always happy tears.
The inclusiveness is so toxic. The love is so toxic. Love is not love. Love is telling you, I love you, but I have to tell you the truth. And the truth is you will never be, no matter how much you try to transition, to alter your body chemically, whatever, you will never be able to fully transition. Except for, there might be intersex people that have two sets of organs, sexual organs. That is very different. I want to make that clear because I get people that comment on my stuff all the time. Well, but intersex people, yes, but there are a small amount of intersex people that have both organs.
It's the intersex argument is really difficult because the problem with that, we don't actually even understand the full data. Because usually parents were so concerned or confused they would either have the baby killed or have the surgery happen at such a young age that it would create complications later on, and so the baby would die. So those numbers aren't even super accurate, and the trans community tries to co-opt it, saying like, oh, look, these people use they, them pronouns because they actually have both sex organs. It's possible. Like, yeah, it is possible for a sexual anomaly, sure, but there's still like sex.
It's very minor.
They're still in two sex characteristics. You're either a male with both organs or you're a female with both organs.
Yes, that's
but you were supposed to be one or the other, right? And those chromosomes are there and exist, and you can identify what they were intended to be born as. And so the fact that they're co-opting that, that's just, it has nothing to do with it. It's not the same thing.
That's right.
And like sometimes intersex people will transition, sure, because they have the option. They can pick one or the other because they have both. But if you're just born one way or the other,
Yes.
You're unfortunately stuck with whatever one you got.
That's right.
Yeah, it's really sad. And I never understood how it was kinder to let someone chase something they could never get. You're dangling a carrot in front of them that they're never going to catch. How is that nice? Wouldn't you want to show them, like, look, just sit there. I know your body's uncomfortable. It's changing. It's puberty. Puberty sucks for everybody. But just wait a few years, because a lot of there's research that states 80% roughly of kids who experience this dysphoria or any sort of gender incongruence, about 80% of them will grow out of that discomfort with the puberty. The puberty is the cure, the natural one. But then the doctors want to stop it before they ever get there so that they can sell you the fake cure that will actually just keep you a pharmaceutical patient for the rest of your life. Yes. Right? It's all about profit for them. It has nothing to do with truth or your actual long-term well-being or how good you feel in your body. It has nothing to do with that. It has very little to do with you as an individual. They don't really care about us as people. They just see dollars. And the more procedures you have, the more money you're making that company and that hospital. And then the longer you're going to have to be on medications, because the more organs you take out, the less you produce naturally. So you're just going to be dependent for the rest of your life. And that lovely part, they don't tell you until after you start. It's really, really sick to see that it's basically every institution that's captured and is just pushing this whole thing. And then to see that it's specifically to target the youngest generations we have is just, you can't see it any other way at that point. And it's very sad. But,
it's sad to think about how much money these people are all making on their products. It's pretty much a product. I feel like we could talk for a long time, but I thank you so much for chatting with me. And getting your point of view. There was a number of things that I never considered. So, and I think you've brought out lots of information that doesn't get spoken about too much, So I really appreciate your time this morning.
Thank you for having me. I appreciate it so much.
Thank you, everyone, for watching. On the website, if you would like to sign my e-petition to opt out of sexuality education in Australia, please sign my petition. Thanks, guys. Bye.